We're here today to talk about the experiences that you all have had at home, at work, as you are balancing both being a doctor, but also balancing being a parent. What is the statement that you feel like is most important to make to the public today?
Not using a mask when you're out unvaccinated, that it affects other people. And I've got 2 young children who are unable to be vaccinated, and it's their health that I worry about the most.
What we do individually affects the community. So our actions go beyond ourselves as individuals or even our families.
I work with the children, I see the children, I have children. We must protect our most vulnerable populations that cannot protect themselves.
Not only just who is at higher risk of contracting it or having severe reactions, responses to contracting COVID, but just this time's effect on our mental health.
It's wearing on our children's mental health. We've seen a skyrocket in suicidal ideations in children. Anecdotally, I've never seen before. Younger and younger ages, kids just aren't able to cope.
There's also the psychosocial effects of wearing masks, for example. There's been some suggestion that young children who need that feedback from people's faces to know the emotion, the intent of what's being said, not being able to see the lower half of someone's face, how will that affect their social cognitive development? And it's hard to know.
Have any of you had to answer any difficult questions from your children about this whole era of COVID-19?
I'm now having conversations with my kids about, because they are physically in school now, is what are the things that we need to continue to do as a family. My daughter actually is working on putting together a series of videos to talk about COVID from the perspective of a 10-year-old.
I definitely have been having conversations with my children about COVID. More so with my older daughter. I have a daughter who's 4 and one who's 2. We talk about things that we can and can't do because of COVID, such as traveling, getting on airplanes, being in public spaces.
What do you think the impact of having a vaccine for children will be?
The news about the vaccination safety in children is huge. I think from a public health perspective, from a physician perspective, and also from a parent's perspective, these are data that have been long awaited and we've been anxiously waiting to hear about. The ages are from 5 and up.
I know some people, may have gotten a little bit impatient or frustrated, even folks like myself, as why is it taking so long? And we still don't actually have availability to the vaccine. There's a little bit more work to be done, but the data that we have is very promising and encouraging.
We have a percentage of the population of adults who have not been vaccinated, who won't get vaccinated, who have children. So I think there's a dual conversation of vaccination of children, but also the adults and parents in those children's lives who will be the ones to make decisions on whether or not they become vaccinated. So I think that's a critical point that we're thinking about in public health.
How do we continue?
The majority of these cases that children are having coronavirus, I should say, is from unvaccinated adults. Okay, and so in knowing that knowledge is power, then as parents, we have to figure out the best way to protect our kids around that.